The practice offers its patients a variety of psychiatric and psychological therapies, mental health evaluations, psychoeducational treatments, nutritional counseling, and holistic treatments. And today we have Monica Nichols. She's a doctor of nursing practice with board certification in psychiatric mental health nursing practice. She's over 10 years of healthcare experience in the areas of pediatrics, family medicine, and psychiatry. She sees child, adolescents, and adult patients with a wide range of mental health concerns. And she's been with that practice since 2022, which is this year. Joshua Joseph is a licensed medical health counselor, clinical hypnotherapist, sorry about that, and a life and career coach. His practice areas of professional expertise and interest are mental health, with anxiety, depression, trauma, and substance abuse. He works mainly with adolescents and adults up to the age of 70. And in addition to therapy, Joshua offers therapeutic and life and career coaching services to individuals, couples, and families at the practice. He's been with South Florida Integrative Medicine since 2016. So we're going to have a short presentation from them. It'll be followed by question and answers. We have plenty of time today, so feel free to ask questions at the end of their presentation. Thank you very much for joining us.
Good morning, everybody.
Good morning.
I'm really regretting not wearing my bow tie after this bow tie and bows. So well, thank you for having us. To the Palmer Trinity team, Denise, Lynn, thank you so much. We're very grateful to be here. And today's topic is going to be on noticing some of the early warning signs of anxiety and depression. But we really wanted to tailor-make today's presentation and limit some of the educational components and really zero in on the question and answer. We found that in the past that can be a lot more helpful for you as parents and guardians. Okay, so if you can, hold off some of the questions until the end, and we'll be happy to address them. And in the event that we might run out of time, we're happy to stick around and to answer your questions one-on-one. Okay? Okay. So just a brief introduction on South Florida Integrative Medicine. I think the word that speaks most to what we do is in the title, right? So we're an integrative practice. If any of you have tried to schedule appointments with psychiatrists, psychologists, therapists in the past, you can, oftentimes there's like a long waiting list, and then to get these different providers to be able to communicate with one another and really tailor-make like a case conceptualization or a treatment plan, it can be a little difficult, signing a lot of different ROIs, to give us permission to share private health information. At our practice, we really make sure that we're regularly meeting with one another to build the full picture of a client and tailor-make their all their therapy and their objectives to their multiple different needs. Okay. So some of the objectives for today are to provide a little bit of education. Can you all hear me without the mic? So I can move over? Yeah? No?
I'm going to grab it out of the stand.
There we go. That's better. Okay, so we're going to cover a little bit of perspective giving. I want to go over some of the, dispelling some of the myths with you all about anxiety and depression. And then we'll go through, Monica will cover some of the early warning signs of anxiety and depression and what those look like. And then I'll give you like a helpful little tip at the end there, something that I hope you all will be able to keep in your back pockets if you're talking to your kids or if you're talking to like other family members, to help remember how to maybe go about or navigate the conversation about these topics with your children a little bit, a little bit more informed. Okay, so I wanted to include a little blip here about evolutionary psychology. All right, so the idea or the premise of this is that we've developed a lot of our behaviors and a lot of the way that we function to like external stimuli around us throughout the years as we developed as human beings, right? And so a lot of, we're going to go over some of the symptoms in a moment, right? But in an analogy that I sometimes share with my clients, if we're in a hunter-gatherer society again and we're going out and trying to forage for food or trying to like hunt for food, this is way back when, and a bush moves, one of our first guttural reactions is that we might be in danger, right? And we're going to go over what some of that looks like in more detail in a moment. But some things that we might notice is we might start to sweat, we might start to pant a little bit, we might start to freeze up or take off and run, right? So what typically happens is when we fast forward several years and we're in a work environment, a school environment, or we're at home, some of the same responses that we had when we were still hunter-gatherer societies are being manifested in the classroom, in our bodies, right? So we legitimately feel that there is a predator, right? In the same way our body might have reacted when we were in a hunter-gatherer society is the same way our body is reacting when we're in a classroom, in a job setting, about to present, right? So that is not beyond the norm, right? And one of the myths that we want to dispel today is that regardless of how grounded we are, woke we are, whatever term you want to use and throw in there, we're going to feel anxious, right? Not medications, not money, not a picture-perfect environment. Nothing is going to keep us from feeling anxious or depressed. Those are normal emotions that we are going to experience regardless of who we are or where we are, right? And the way our body is going to react is the same way it's reacted for years, right? We're biologically wired to react that way. Okay, so we're going to talk a little bit about how to have this conversation and how to learn the early warning signs of what this looks like, not just in our own bodies, but how to notice it if it's happening with our kids. Okay? I'm going to hand over the mic here to Monk.
Hello. So as he was explaining, we are naturally wired to feel anxious when we have imminent threat or danger approaching us, right? But the problem with anxiety is that sometimes we will mount this response even though there is no imminent threat or danger, right? So a little bit of worry is good, right? If they weren't worried about the grade they would get on the test, they wouldn't be inspired or motivated to study. If we weren't worried about how we would pay our bills, days we don't want to go to work, we might not go to work, right? So a little bit of worry is a good thing. But in anxiety, we see that this anxious response is either present continuously throughout the day, right, with generalized anxiety, or it can be with public speaking, social situations, right, or, phobias, right, so spiders, flights, elevators, and things like that. So some of the symptoms, so it's really important to know that kids and teenagers are not little adults. The way they present psychiatric conditions, also medical conditions, is different. So when I think of anxiety, I always think of the little kiddo that has nausea, vomiting on a Monday morning, right? Every Monday they're vomiting. Every Monday they have stomach pain, right? They go to the doctor, they go to the ER, they go to a gastroenterologist, multiple visits, and it's like, hey, maybe it might be anxiety, right? So little kids, they really present it in the stomach. My adolescents, I actually see them more chest pain, shortness of breath, palpitations, dizziness, fainting. Again, it's not uncommon that I see a child for the first time with their parents, and it's like, yeah, we've been to the urgent care, we've been to the ER, we've seen cardiologists, and they say everything is normal, but why does this keep happening? So I'm like, well, maybe we need to think about anxiety. And so also really important to know that kids and adolescents are resilient, right? What that means is that they hide a lot of these symptoms and they kind of keep pushing through before you're able to really see it on the outside, right? So something very common in practice that I see is, for instance, I ask the parent, oh, well, how long has this been going on? Oh, I really started to notice like a month ago. I asked the kid, how long have you felt this way? Oh, 6 months to a year. And the parents are always shocked, right? Because kids and adolescents, they hold it together until they can't anymore, right? So hopefully one of the goals of this presentation is that you'll see kind of like the early signs, right? So physical symptoms. Physical symptoms without a medical reason can be kind of like, maybe we should be thinking about anxiety. You'll see also worrying, low energy, because when you have that nervous system response, fast heart rate, right? There's no blood flow to your stomach because it's all pumping to the heart and the brain. So food is not digested properly. So they have stomach aches, they have nausea, right? So then they have trouble concentrating. So grades will start to slip because why? Because they're worried all the time. So they're not focusing on studying, they're not focusing in school. And then one that I always do see is that they feel restless and on edge. So how might that look like to you as parents? So let's say they wake up in the morning and they're nervous about school. So the minute they wake up, they're worried, they're anxious, they're thinking about things. Couple regular anxiety with social anxiety, and now they have to do things in a social setting at school. So by the time they get home at 5 o'clock, they've been running on a heart rate of 100 and something all day, right? That's not a pleasant place to be. So then 5 o'clock comes and you say, hey, pick up your room, and suddenly they explode, right? It wasn't that you asked them to pick up their room. They're not trying to be little jerks on purpose. They've just been running on adrenaline all day long, and so that one thing can set them off. So a lot of times in kids with depression, anxiety, it's not uncommon that the parents will be like, they're so irritable all the time.
So, I know it wasn't that long ago that I covered this slide, but I didn't want to miss the opportunity to connect these two concepts, right? So Monica just mentioned, let's see, trouble concentrating. She mentioned how nervousness can manifest in like younger children or younger populations in the stomach, but even as adults, we feel it sometimes in our, like a pit in our stomach. So that example that I gave you of a predator potentially in the bush, well, like Monica had mentioned, we stop digesting food because we need to get ready to fight or flight or freeze to blend in, and a new one is fawn, and we'll cover that in a moment, right? But that's also why our mouth tends to get dry, because we're no longer focused on food digestion, but we're focused on responding to danger, right? In addition to that, our adrenal glands might start pumping, and we'll notice like sweaty palms. Some people, especially if they're having like panic disorder or a panic attack, sometimes they can get a little bit of a bird's eye view, so they get a little dissociated from the event, and it's almost like they can see things through a tunnel. Breathing happens in the upper chest area to respond to stress instead of in the diaphragm, which is why breathing has become a technique that a lot of you have probably heard about through mindfulness or even prayer, right?
Really quick, going back to that, so prolonged and untreated anxiety, the long-term consequences is how it affects their life day to day, right? So you'll see school refusal, they don't want to go to school, right? They don't want to engage in social situations. And then in, like, let's say public speaking, right? That limits their potential because they avoid situations that'll cause them discomfort, you know, that might give them better opportunities. So then when we talk about depression, right? Depression, it's normal to feel sad when something sad happens, right? That's important, it's a normal emotion. But when it becomes prolonged, and I go back to that affecting your daily life, that's when we know that it's a problem. So depression, sometimes a child or adolescent isn't gonna say, I feel sad. Some do, some will actually say the emotion of sad, you will see them crying. But for some, they say it's more of a numb. Numb is a word I feel a lot. Emptiness, blah. That's kind of what the adolescent boys say, but I just feel blah, right? So depression, you might not just see them crying all the time. That might not be what you see. But you might see low motivation, right? They just kind of don't want to do anything. They're isolated, they're withdrawn. They don't want to go to social functionings or social gatherings. They don't come out and talk to you as much. They're kind of holed up in their room. You might see, for instance, trouble concentrating as well, right? They're just kind of low energy, low motivation. They don't want to do the things that they need to do. You might see some weight loss or even weight gain. Depression can have decreased or increased appetite, depending on how they're choosing to cope, right? So you might see them pushing around their food at the dinner table, weight loss, maybe wearing baggier clothes to hide the fact that they've been losing weight. Same thing with sleep. They might either sleep all day, so it's like the weekend and they're just in bed, they don't want to do anything. You try and wake them up and they're just kind of curled under the covers. Or you see little sleep, right? If they're up and they're worrying, then they have a hard time falling asleep. So then what you'll start to see is that they kind of feel slowed down. You might see hopelessness, helplessness. So remember that adolescents have a very limited world and experience view, right? So adults, right, we've lived for several years, we've had several experiences, we've had bad things happen into our life, and we know that usually things get better, right? They don't have that concept. So when they feel depressed, they might start thinking, I'm always gonna feel this way. There is no hope for me. This is gonna be my forever, right? And with that thought becoming prolonged, unfortunately, then we start to get where children will have thoughts of self-harm, and even suicidal ideations, which is what we want to try and avoid, right? And so one of the concepts is that sometimes these kids feel alone. So I could do a whole talk on social media, but tying really into the depression point, I wanted to bring up that when kids feel alone, they do always try and reach out, and unfortunately, they're probably reaching out to social media and the internet, right? So if we're talking about social media algorithms, right, and again, I can do a whole talk on that. So for instance, a kid will look up, am I depressed, right, into Google, am I depressed? What is depression? Or they'll tell their friend, and their friend's like, oh, hey, I think you're depressed, and then they start Googling it, right? So then what happens? At first, they're gonna get maybe, hopefully, good content. CDC definitions, right, health department definitions, maybe some good TikToks of therapists, right? But eventually, the algorithm's gonna be like, oh, you like depression. Here's more depression stuff, right? And then you'll start to see maybe stories of someone, oh, I used to be depressed and this is how I got help. So you have some positive stories. So you go from professional resources to kind of personal stories that are hopefully positive, but eventually maybe someone will make a comment of, before I got help and I was depressed, I used to self-harm, or I attempted to end my life. So now the algorithm changes. Oh, you like topics of self-harm. You like topics of suicidal ideation. Then social media starts giving you probably videos that are now really not good of people actively in depression that are engaging in these kinds of acts, and that's where it becomes scary, right? Because they want to feel that they are understood. So if they're not getting help from professional resources, right, it becomes an echo chamber where they just kind of sit and obsess and then start watching those videos, and the algorithm goes on, and then eventually it starts, you know, an innocent search looking for help and resources has now turned a lot darker, right? So that's one of our, you know, primary goals is how can you identify it early enough and not stigmatize therapy and mental health, right? Because we want them to get resources and services from trained professionals and not kind of ask their peers so much or, you know, go on the internet.
I'm wondering if anybody picked up on some of the symptoms that are alike between depression and anxiety. Anybody pick up on some of the similarities?
Staying in bed.
Staying in bed is one of them, great. Any others? Eating, awesome. Any others? Stomach ache, yeah, very good. And the one that stands out to me most as a parent is low frustration tolerance, because that's probably the roughest as a parent that I have to deal with, and my kids are still pretty young, right? And the reason why these are somewhat interlinked is that on a neurological level, there's very similar interrelated things going on, right? But in very layman's terms, what's typically happening with low frustration tolerance in both of these areas is an individual's just energy is spent all day running in circles, whether it's worry, whether it's depression and the hopelessness that Monica was talking about earlier. So sometimes it's very difficult to parse out, is my child feeling anxious? Are they feeling depressed? Like, what's going on? Are they feeling both? Because sometimes if we're feeling anxious for too long, we start feeling depressed that there's no hope that we're not going to feel anxious anymore. And sometimes if we're feeling depressed, we can't talk about it, we start feeling worried that somebody's going to pick up on us being sad, right? Like, oh, you know, I have a car, or I have a really nice house, or, you know, I just got back from Disney, or I just got back from traveling. Like, there's no reason I should feel depressed. Oh my God, like, what if my parents find out? What if my friends find out? What if my teachers find out? So sometimes these diagnoses are linked together, not just in symptomology and neurological reactions, but also in behavior and the way that we think.
Yeah, and one of the things that I always say in practice and I explain to the parents as well as the child is that anxiety and depression are like each other's unwelcome passenger. It's really hard to find one without the other somewhat lurking. I usually just say which one is bothering you more. But neurochemically, right, we know that serotonin can be part of depression and anxiety, right? So it's very hard to find one without the other, at least in some capacity. And how he said, which I see a lot, is anxiety will eventually turn into depression. Because you can't keep that response for so long until you're just completely drained. So I think that was a great point.
Thank Thank you. And you know, I want to kind of circle back. I tried to include some little emoticons, but PowerPoint has this weird way of changing the things that I put in there. So I apologize for the kind of bland icons in here. But the idea is I was thinking, okay, well, there's a lot that Monica and I are coming to you all with today, right? And I didn't want it to become like so educationally focused that you all kind of like lose sight or don't end up with like a tool to be able to like apply when you get home with your kids or with other family members or even with like a spouse or a partner, right? So I was like, all right, well, let me comb through these different websites and see like, okay, what do they all recommend and kind of distill it for the parents, right? And you know, there's like a helpful slide of all the different research that we cited and different websites that we went to. But if I were able to boil 3 things down into what I might find helpful as a parent myself, it would be to start getting really curious with your kids, right? And a conversation where I'm trying to figure out what's going on and I'm being judgy is very different to a conversation of, hey, I want to know what's going on, like tell me what's up, right? Kids have an uncanny ability, especially teenagers, in pinpointing when they're being judged. So as soon as your thoughts start to go in, oh man, I gotta worry about so-and-so and such, or oh, you know, this is my plug, this is where I should come in with like drinking and driving piece, or the, or this is where I should like make mention of the fact that, you know, like there's no reason to feel sad, I'm always here for them. Like, no, like put on the brakes, set that instinct aside, which is the hardest thing as a parent to do. Because none of us want to see our kids run into a brick wall, right? But I'm telling you, the science and experience shows that the best way that you can get through to your kids is to set the judgment aside just for that conversation. If I start walking into this podium, it doesn't mean I'm doomed to walk in this direction forever. Just because you set aside the judgmental parent mode for a little bit doesn't mean you can't go back to it later, like right after the conversation, right? But taking a moment to just get curious with your kids, like that's huge. And sometimes in therapy, especially with teenagers, sometimes that's all it takes. Is just having an atmosphere where they can feel like they can talk to somebody without judgment. And sometimes just that space can be incredibly beneficial for the individual, even as adults, right? So the first step is to get curious, right? And then this was supposed to be a much more glaring red X, right? And this is the idea of dispelling misinformation, because we live in a world where it's so easy to access information, and that's amazing, that's great. The difficulty is that we also live in a world where critical thinking and like discerning what's reliable and what's valid is become increasingly difficult. So not only has the information access gotten higher, the ability to discern what's valid and reliable has gotten lower, right? And I think in this kind of conversation, that might look like, hey, you know, I know that you are hearing that sometimes like vaping, right? Because we know that that's like a big thing, and as early as middle school and high school, and we've, you know, done talks about that, and that hasn't changed, right? But, you know, hey, I know a lot of your friends are vaping, or I know a lot of your friends are drinking at parties, right? I know that happens, right? And I'm not here to judge, but that isn't the best way to like deal with some of the feelings that you're feeling, right? Dispelling some of the rumors, because like Monica had mentioned, a lot of them turn to social media, or, you know, websites, or Google, or Reddit, or Discord, I mean, you name it, right? They have all these different platforms to communicate, and again, that's great, but how do they discern as teenagers if we can't even as adults what's valid and reliable, right? So that brings me to step 3, and that's like talking to a professional. And I don't just mean us, right? Like a psychologist, a therapist, a doctor, a psychiatric nurse. All of us are great. That's probably the best source to go to for intervention. But it could also be looking up like a motivational speaker or finding a self-help book, right? Like, again, making sure that these self-help books or speakers come with credentials, right? Because some people don't respond to one-on-one meetings with an individual, right? In an ideal world, we all would. But some people respond really well to self-help books, or just being able to go to like a group therapy, or join a team with sports and be able to kind of exert some of the energy instead of feeling at home, you know, frustrated all to themselves. So I want to highlight these 3 just once more. I'm calling them the helpful 3s, but don't quote me. It's get curious, dispel misinformation, and speak out. And by the way, speak out's really awesome as a parent, because depending on the age of your child, you could share an age appropriate. My kind of rule is it beneficial and is it appropriate, right? I'm not going to tell my 3-year-old about being anxious before meeting with like a Palmer Trinity like family and administration and staff, right? because they're 3 years old. So the twins are not going to understand that. But if I tell them how today daddy felt like a little nervous in his belly, and that he knew it was going to be okay because he came with a friend and showed up to meet other friends, right? That made me feel better. They can get that. That can sink in for them, right? So sometimes self-disclosures, even if you haven't resolved it yourself, even if in the moment you're feeling anxious or depressed, sometimes age-appropriate disclosures can be all it takes to open the door for your kid to disclose more or to share what's going on. Okay? So again, professional can be you, right? Your own stories. I mean, we've learned from generations since the hunter-gatherer societies I referenced at the beginning, the way that we learned was through word of mouth, right? And so what better word of mouth than to come with a parent who's carrying all that power as a parent and be able to like put down the walls and be vulnerable with your kid for a little bit. All right? So again, three helpful steps: get curious, dispel misinformation, and seek professional help or disclose, right? Speak up.
Yeah, I wanted to add one quick thing to that, is that a lot of the times parents might feel intimidated in the regards of, what if I say the wrong thing? Like, what if I ask them how they're feeling and they tell me, God forbid, they're having thoughts of not wanting to be here? What if I say the wrong thing? You know, teenagers and adolescents, they have a sniffer for genuineness, and I always say, as long as you come from a place of compassion and love, you can always say, oh, I'm sorry, I didn't mean to, you know, come off judgy. Oh, I'm sorry if you misunderstood. You know, if you do say the wrong thing, apologize for it, right? They really respect that and they see that, you know, and say, hey, I might not know the best answers, but, you know, tell me how you're feeling. And I think a lot of the times we avoid those hard conversations just because we don't know what, you know, what to say. And we're afraid, oh, if we say the wrong thing, am I gonna put something in their head? And so I always say, as long as you come from compassion and love, and then just an open mind, you know, to be able to admit when maybe you weren't as supportive or maybe you were a little judgmental, right? They really take that in. So I think it's important, you know, to not let that fear of the conversation scare you away from having them.
A couple things just before we wind up with the question and answers. If you all want to take a picture, I know Denise had mentioned that this is going to be recorded, so in the event that you don't want to take out your phone or take a picture now, you don't have to, but these are like two helpful links, both from the same source, two different sources, sorry. But both of them have like a plethora of different like PDFs and little folders on how to like talk to your kids about anxiety or depression. If you all want, you know, some more guidelines, I'm a big believer in, you know, jumping right in, right? So it kind of puts you in a position to like forcibly be authentic, right? But if you would like some more direction, which I can understand as well, you can find them at these two different websites. Okay. Now, I didn't want to leave any loops open, right? So we're all familiar with fight, flight, or freeze when it comes to anxiety, right? Potential predator in the bush, you know, hands start to get sweaty, mouth gets dry, stomach starts to feel weird, we get bird's eye view, we're starting to feel anxious, right? All the symptoms of anxiety and a panic attack if more severe, and we get ready to fight, we get ready to run or flight, which everybody, you know, most people know about those two responses. But there's a third and a fourth, which is freeze and fawn. Fawn is the one that is relatively new, and I don't know if any of you have a parent, like a child or a family member like this at home, but an individual who fawns is when their body is reacting to danger or what they perceive or think to be danger. They start to try and make sure everybody else around them is feeling okay, right? Like, hey, how you feeling? How are you doing? Can I get you anything, right? Oh my gosh, like, oh, you don't like the chair that you're on? Switch with me, right? So sometimes it's like fawning, trying to make sure other people are comfortable. Sometimes that's a clear indication that an individual is feeling pretty anxious as well, right? So that's fight, flight, freeze, and fawn, okay? So these are some of the resources, and then at the beginning of our slide and at the end of our slide, we included this little QR code. This you could just take a picture of, or if you highlight it with your camera on your phone, it'll give you the option to pop to a link, and that link is to our website. So you'll find more information on not just Monica and myself, but also Hugh Humphrey, the founder of the practice, and Reed Humphrey. We are a family business that's been around for 8 going on 9 years. And if you have any other questions about our practice, what we offer, etc., it's there. And we're going to open up the space for question and answers, but you know, before we do, thank you so much again for having us.
All right, I'm going to start with a question.
Sure.
How do you know, how can you tell the difference between, a typical moody teenager and something that's a problem, that, or potentially could be a problem?
So I'm going to let Monica speak to this briefly. Typically, what will happen is your normal teenager will be moody regardless of what you do. So like, there's no way around it. But when that moodiness starts to cause dysfunction, so personal hygiene, sleep hygiene, academics, if they have a job or they're volunteering, if any of these things start to waver, right? So their socialization gets lowered, their personal hygiene gets lowered, their sleep gets disrupted, their school, their academics, their behavior starts to shift. When their functionality starts to change because of their mood, that's often a big sign that there's something more than just, what was the word you used earlier for a teenager?
Little jerk.
Little jerk. Little jerk. Yeah. Did that answer your question? Yeah.
Perfect.
To add to that, the way that we do diagnose psychiatric conditions, right, we use the DSM-5, right? That's kind of our criteria for diagnosis. So both generalized anxiety disorder and major depressive disorder, they both come with the, that it has to affect activities of daily life, right? It has, like you said, functionality, right? So if he's moody with you, but then he goes out and has a blast with his friends and he's doing everything, getting okay grades and things like that, more than likely not a mental health condition, right? Just hormones. But when you see activities of daily living are starting to decrease, school grades, not wanting to participate in sports, not wanting to attend family gatherings and things like that, then you know that it's a sign of an underlying problem.
Yeah. And we'll often get like, children, teenagers, even adults, we'll often get them into the office reporting that they're having issues at work or at school, or parents are like, hey, I don't know what to do, they're getting in trouble at school, etc. That's never a priority for us, right? We know that we often hear it, but that's secondary, right? Typically what will happen is if we focus on helping heal the mood arena, the other stuff will follow, right? But if we kind of zero in on just the functionality, then we lose all the potential of tapping into the mood. It's just a Band-Aid, right? So again, we often get kids coming into our office, or teenagers and even adults, hey, I'm having issues at work, I'm having issues at school, my kids are having issues at school or work, we need your help. Well, what you're saying without knowing that you're saying is that your kid needs help in the mood arena, the functionality stuff will follow, typically. Any other questions? Yes.
Do you make a distinction between like depression that's caused by prolonged anxiety and chemical imbalance depression, and what are some of the are there different treatments, and what are they?
Yeah, great question. I'm gonna let Monica speak to this one.
So when we talk about treatment, right, a lot of the times parents come and they're really afraid of like, oh, I don't want to put my kids on medication, right? And so when we're talking about mild anxiety, mild depression, usually medication isn't the first line, right? So there's pillars. When I talk about treatment for these disorders is therapy. Therapy is the gold standard. Everyone needs therapy. The therapist needs therapists, right? So that's where I start. Therapy is a non-negotiable for me, right? Everybody needs to do therapy. Then, so remember, this is for mild, right? Exercise, good nutrition, appropriate supplements, right? There are supplements that we can recommend for things like anxiety and depression. When we have anxiety that is causing panic attacks, then I do talk about options for medications and treatments, but that's along with therapy, nutrition, exercise, appropriate supplements, right? It's never a standalone treatment modality. And then when we talk about depression, right? Mild, maybe sometimes moderate depression, therapy is usually our first line, right? 3 to 6 months of therapy and see how that works. When the depression does come with self-harm or suicidal ideation, then I'm more prone to say, okay, no, we need to add medication on board, just because I always kind of say sometimes the medications help the therapy work faster or better, just because of the way it increases the brain's ability for neuroplasticity, which is the brain's ability to grow and adapt and learn more information. So necessarily to your question, do I differentiate between depression caused by anxiety or just depression? Not necessarily. Sometimes we do try and play what came first, the chicken or the egg. but the treatment doesn't really change, right? The treatment is therapy is number one, exercise, nutrition, appropriate supplements, and then medication if and when we need it, right? And a lot of the times the questions I get is, oh my gosh, I don't want my kid to be addicted to this medication, right? The majority of medications that we use, especially in kids and adolescents, aren't addictive, right? And they're not long-term. I don't want to see them on medication past a year in most cases, right? 6 to 9 months, I usually say, when the child is stable. But what doesn't change is, again, the 4 pillars, right? That is a lifelong commitment. And even with therapy, I always say, even when you're doing great, you should always check in with your therapist once a month, you know? And then as stressors come, so, you know, as adults, we know things like getting married, getting a new job are happy events, but that also creates anxiety, right? So when you have someone like a therapist or a counselor that you talk to, during these lifetime moments, it's like, okay, maybe I go back to other every week sessions, and then everything's good, stable, I drop back down, right? So it's always having someone in your life that's your own objective person, I think is important.
Yeah, at the beginning of the presentation, we talked a little bit about the integrative word in South Florida Integrative Medicine. So one of the other perks at our practice is that in addition to your regimen of medications and therapy, there's also things like genetic composition. So how does your liver metabolize certain medications depending on your background, like your genetic background? So instead of using up a lot of time trying different SSRIs or other alternatives to medications, we can find really tailor make what medication is going to be best suited for the person depending on their genetic composition. Also, vitamins and nutrients, right? Those can sometimes have a pretty radical effect on the body. Science suggesting within the last 5 years that chemical imbalances is a solid direction to go, but that inflammation can also lead to things like depression and anxiety, right? So, the field is ever changing, ever evolving, and I think it's important to mention, right, that there are alternatives to therapy, to medication as well. Did that answer your question? Yeah? Any other questions? Yes? Let me walk over to you, Sue.
You can just let to it, alternative to therapy you mentioned, if you have a child that he doesn't like to speak about, somebody that thinks he troubleshoot alone.
Yeah.
And he doesn't see the benefit of going to somebody's office, how do you?
So the question for those of you who might not have heard is how do you address an issue of depression or anxiety with somebody who's maybe a little bit apprehensive about meeting with somebody else, or who's like a self-starter, right? So a self-help book is helpful. Art therapy is helpful too. There are members in our community. So we do play task and play therapy at our practice, right? But there are people outside of our practice. One of them by the name of Gary Lancelota. So he'll take groups of kids to go rock climbing. He's a psychologist. He'll take kids to go rock climbing. He'll give assessments. He does testing. He does therapy. So again, one of the benefits of going to an office or meeting with a provider is that you can get access to some of these different providers in the area. You can get a consultation. You can find out, okay, well, what direction should I point my child to? So again, there are options outside of your traditional therapy medication route, right? Now, there might not be supported by evidence as much as an SSRI in combination with therapy, but that doesn't mean that they don't hold value for some, right?
To speak to that really quick is that also therapy is like a relationship, right? So maybe the first one is not a good fit if the kids say they don't have the same vibe, right? So I always say, some styles work for some and doesn't work for others, right? Some therapists tend to be a little bit more gentle and soft. Some seem to be a little bit more confrontational. And so everyone has a different type of person they get along with. So I always say if it hasn't been working out, try another one, right? Sometimes you do have to see multiple therapists till you find your fit, right? Because therapists are human beings too, so my style might not be your style. So we can send you to someone who might be more your style. So I think that's important as well. If they're being really resistant, say, okay, hey, do you want to try someone else? And I think that's important too.
Yeah, and you can give us a call, send us an email if you have questions about different providers in the area. In addition to that, Psychology Today is like the Facebook world or the LinkedIn world for psychologists and therapists. So if you want to, look within your own network, or if you want to go outside of your network to like a private practice, for instance, you might want to look into pulling up what the providers are within network or that you've heard about in your community, and then go to Psychology Today, type in their name, and see if they have a profile. And that way you can read a little bit about how they are presenting themselves to you all, and then maybe even give them a call, send them an email, and find out if it works, right, if there's rapport. So I saw at least 3 different questions. I'm going to kind of tackle them left to right, if that's okay.
Yes. I would like to know how to difference when it's an anxiety problem or just like an anxiety rush. Because sometimes it happens to my daughter or even to me that you have busier weeks than others. Maybe a lot of accumulated work at school or social events or things like that. And of course you get anxious. So when do you call it a problem and when you do not?
Yeah, I think this is similar to the mood functionality piece.
Okay. So I usually say that, stressful, you have a reason, right? Stressful season, kind of things going on, and then it drops off, right? During that time, they are still able to maybe go to their social events, they still want to interact with you as a parent, still interacting with their friends, and then there's a drop off, right? The test goes, the final goes, the assignments are turned in, and then there's a return to baseline, right? If we're going by the DSM-5, it's 6 months. For generalized anxiety, it's 6 months of when these symptoms have been going on that have been affecting daily life. Depression, it's only 2 weeks. So if you're that bad for 2 weeks, that's actually criteria. Anxiety is about 6 months because life is going to be stressful, especially nowadays. There's a lot on these kids' plates, right? So you should see it in seasons. You're really, really anxious, and maybe if your child tends to be more of a type A perfectionist, right, their level of stress is going to be higher because they want to do well. But you should see once that drops off that there's a drop-off return to baseline. But that during that time, she's able to cope with the anxiety. Like, oh, I have so much to do, I'm gonna go study. Not, I have so much to do, I'm gonna go lay in bed the rest of the day. If that makes sense. Does that answer your question?
Anybody ever seen what their heart looks like at a hospital or a doctor's office, like the little beeping, right? Like another, I'm big on analogies and metaphors, so I apologize if I lose you, just throw like a tissue paper or a box. So if you've ever seen how the heart beats, right? This is the way I sometimes explain like symptomology to clients, is like if they have like a very strong, intense, anxious episode or depressed episode, you're gonna see it very strong in the heart monitor, right? You're gonna see it like a heartbeat beating really hard or strong, right? And then you'll see it taper off. How long they spend in that place, right? Could look like, instead of beat, beat, right? So how long they spend or the duration, right? That's problematic. If the intensity is higher than you've seen in a while or starting to get higher, or, so that's intensity, duration, and frequency. So how often are they going through these episodes, right? So if they're happening, here and there, probably within the norm, even if they're sometimes intense, right? These things happen. But if you're noticing the intensity, the duration, or the frequency of these depressive or anxious episodes, or even both, like changing, then that might be when you want to consult a professional.
Yes, a friend of mine, which she's a psychiatrist, recommend NAC, an N-acetylcysteine, that is like to calm them down. When, these episodes of exams and stuff, they have a side, but I really, there's not so much research out there, it is really, this is out of the corner, it's a protein, it's well tolerated, but what is your input in that?
Yes.
And I have another question too. A lot of the kids bite their nails and how they have pickups. Where is that? Because I didn't see any of that in where is that you would put it?
So let me go with the easy question first, which is the nail biting. So the nail biting,
That's the hard question.
Oh yeah? Because NAC I can get complicated at NAC. So with the what's for you over here, right? Different stressors.
Yeah.
So nail biting, right? So that's there with fidgeting. Now, how damaging is it? You know, this is where it's like a case-by-case basis. Does every kid that bites their nails have severe anxiety? No, not really, right? But if they're biting it to the bone, if they're skin picking at their skin, their scabs, hair pulling, right? Now we're looking at, yes, that is more severe. If it's kind of just a nail biting in a stressful situation and just kind of say, get like a fidget bracelet or get like a rubber band or, you know, do something else with your hands. It can be just idle time or learn other coping skills. So it depends again on the severity. So it can be just a completely normal thing that some people do. I say get like a nail polish or like a no bite varnish to kind of, right? But if you're going all the way down, you're causing infections of the nail, you're picking at your skin, pulling your hair, now we're looking at something more severe. Going back to supplements, so supplements are powerful, right? The majority of our medications used to be over the counter, right? So that is a case-by-case basis. NAC is something that I do recommend in practice for certain individuals for certain cases. I don't think it's something that everyone should be taking. Yes, it's an amino acid, it's a building block of glutathione, it's fantastic for immunity and for other things, but it does come with some side effects and interactions. So again, it is something I use in practice, but on a case-by-case basis. I wouldn't say anyone who's kind of anxious, take it. It doesn't work like that. It's not an anti-anxiety, like in the moment type thing. I tend to lean more towards like magnesium for like in the moment anxiety. NAC is something that has to build up over time, and for that general anxiety, like in the moment, I usually don't use it. But again, it's case by case.
With regards to nail biting, I find it just more difficult because there's a number of other diagnoses that we have to consider when there's something like nail biting in the picture. And because I know very little about NAC, it's just it's the harder question. Yes.
So I'm just related to that. What kind of foods, if I just use anxiety as an example, would stimulate anxiety? And what kind of foods would counteract the anxiety? So one way, if your kid was eating certain foods, then you'd have higher, I mean, I can think of a couple off the top, but I wanted to hear your opinion about what kind of foods would stimulate that, and what kind of foods, if your kid had high anxiety, what kind of foods would help him reduce the anxiety that he had or she had.
Yeah, so the question is if there are foods that we should avoid or gravitate towards if we're feeling anxious or depressed. It's not a simple, unfortunately there's not a simple answer. In fact, I would point out one nuance in there, and that's that most food is healthy food, right? And I know some of your parents are gonna freak out that I'm saying that. I mean, even candy, right? Things have nutritional value regardless of what they are. So the idea of what's healthy for some and healthy for others really should be up to the dietitian or nutritionist. A lot of eating disorders that come down the route of, well, let's avoid this, let's avoid that. But I will say that mindful eating, regardless of what they're eating, is going to go longer than restricting or opening up diets to new foods, right? So I'm a big proponent in mindful eating. If you're going to go down the route of what's going to be best on a nutritional level for this individual, inflammatories, those type of things might be something to avoid. But then again, it's very tricky and dicey when you come to a nutritional level, because even if you know that you're more prone to like the nightshade family, right? Like tomatoes, eggplants, that sort of thing. Could be that your body still needs it even though you're inflamed by it. So restricting it might be to the individual's detriment. So if we're going to go down the nutritional route, something that I advocate for, because I'm not a doctor, is, well, speak to your doctor about what to avoid and what to eat, but try and engage in some sort of like mindful eating, right? Like let's spend a few seconds noticing how this smells, how this tastes, because that'll help you with some of it's part of a grounding activity. So for people who are anxious, that's helpful. And it helps refocus the individual from their hopelessness and helplessness of thoughts to like the task at hand, which can give them a little respite from the repeat pattern recording of, well, this is impossible, I can't get out of this, etc.
So to talk about the mindful eating, again, I always say eat the rainbow, right? Your plate should have different colors because that covers like fruits and vegetables and different vitamins. So I always say eat the rainbow. That's to me one of the more important things. Now if we're talking about anxiety, I tend to kind of go by the same thing that I do for like ADHD, which is you want to I know he said not to avoid things, but limit caffeine, limit sugar, limit processed foods, limit straight pure carbohydrates like the white rice, white flour, limit, right? You don't have to avoid. We should never, demonize a food, right? But limit those. And increase foods with omega-3. Almonds, salmon, right? Avocados, rich fatty foods is great for mood, attention, anxiety, depression, and it also helps our medications work better because it just helps with the neuroplasticity of the brain. And then cruciferous vegetables, so your broccoli, your cauliflower, because those also are higher in magnesium, selenium, and all those good things that help with anxiety and or depression. Also, finding out if there are foods that trigger you, right? If you have an inflammatory reaction, so you can get that, via either gut testing or, food sensitivity testing. If you see that you're eating foods so for some, dairy is a trigger, right? And so if you find yourself that you're sensitive to dairy, right, that could trigger mood. Celiac disease is a big one that I test for in the office all the time. If you have a sensitivity to gluten, you might need to avoid gluten, and that's gonna help you feel better too. So those are, when you work with someone who has a more holistic approach, right? I don't just keep increasing the medication. I'm like, okay, let's see, is there something else going on that can help optimize?
Another analogy. As it relates to omega-3s, the way that I sometimes explain this to parents and to clients as well is when they start omega-3s and let's say they're taking another medication, is if you walk on a field of grass enough, right, what happens is you end up noticing that there's trampled grass there. You walk on it even more, the grass kind of dies in that area. So regardless of where you're going, you're going to continue taking that path because it's one that you've grown familiar with over time, right? So omega-3s, what happens is, all right, revisiting the path. If I'm sad or anxious and I'm following a train of thought, right? In my brain, you can imagine that electricity is being sent down the same highway over and over again as it relates to feeling anxious or depressed. Medication therapy typically helps us take a different path. Omega-3s help us reinforce that path. Right? So what happens is we see the direction of thought and behavior that has often led to feelings of depression or anxiety. It's really easy to take that path again. Medication and therapy help you explore new paths, and omega-3 can help reinforce those new paths, right? But you also want to make sure that the omega-3s that you're getting are reliable.
Yes.
Right? Yes. I think you had your hand up in the back for a while. Yeah.
Yes, and my question is related to social media. So can social media cause the parents to have a own anxiety, be exposed to social media?
Can it cause, maybe it doesn't help. So yes, in the regards of, remember, everything that people post on social media, for the most part is a lie, right? You only post the best pictures of yourself, right? You having a great time. You're not posting that you're crying, that you're working, right? You're posting these illusions. So for kids who have limited life experience, they feel like that's the only reality and why aren't they attaining that and why don't they look like that? And so then in that aspect, yes, if, it could cause those symptoms just because they feel like they always have to live up to this standard that in reality is fake.
You also, if you're doom scrolling, for instance, or if you're just kind of scrolling through, let's say TikTok or Instagram, these are quick videos that are eliciting a lot of different emotions. So in the event that you're kind of scrolling through, let's say the search area of Instagram or you're in TikTok and you're just kind of scrolling through the different algorithm videos that they're tailor making for you, what happens is, remember those little highways or pathways I was talking about earlier that omega-3 helps enforce taking different pathways? What's happening is the brain, like the areas of the brain that light up for creativity, the areas of the brain that light up when there's like romance or sexuality, the parts of the brain that light up for guilt and shame or anger, right? Like when you're flicking through these videos, it's not just we're seeing a video and flicking through, like these parts of the brain are turning off and then turning off as we go on to another stimuli. So that can become like an information overload, right? And sometimes that can lead to a little bit of burnout or other thoughts about self, the world around us, or there's a cognitive triangle that I go in a lot of times in therapy, and it was created by Aaron Beck and Albert Ellis. who are kind of the founders of cognitive behavioral therapy, and they talk about this cognitive triangle. And this cognitive triangle suggests, and science there's a lot of evidence to support this, that we're typically depressed because of 3 origins of thoughts. We're typically anxious because of 3 origins of thoughts. So, what are my beliefs or my thoughts about myself? What are my beliefs or my thoughts about the world around me? And what are my beliefs and thoughts about other people around me, right? And so if all 3 are dysregulated, right, I'm a bad person, this world is ending, or it's not worth living in, and other people around me aren't supportive, like that might place the individual at a very high risk, right? But sometimes just one deficit in those areas can be enough to elicit like an anxiety episode or a depressive episode, like I'm not good enough, social media connection, right? So just some thoughts.
Yes, but more and more we starting to go down more knowledge about psychobiotics is what they call them, and we are actually finding that if you are prone to like inflammation or histamine, you can be sensitive to some of the lactobacillus strains and things like that. So in general, yes, a good quality probiotic can be helpful. If you find that it's making it worse for whatever reason, you might need more tailored like gut health testing to just make sure that there's not an overgrowth of the one that you're taking. So in general, yes, a good, from a quality resource, right? Yes, can be helpful. But if you find that it's giving you side effects, like some people have more histamine intolerance, so they take lactobacillus strains and suddenly their anxiety skyrockets, right? So then those are the ones that we might need to do more testing on.
And some of the pharmacists that will occasionally visit our practice, or that visit all doctors' offices, some of them have, like the same people who are putting out medication for anxiety, depression, symptoms of psychosis, disassociation. Some of them are putting out their own brand of probiotics now. All of them are refrigerated, shipped with refrigeration, right? I mean, that's why you have to be careful with what supplements you're buying, and why we would recommend speaking to like a doctor, really, like somebody like Monica, because it's really easy to Google things and find things, but it's really hard to determine nowadays whether that's valid or reliable information we're picking up on. Yes? No, you agree, yeah.
Is there, in terms of the speaking to your children and curiosity and lack of judgment, I really struggle with that. Is there a rule of thumb about how much time per week or per day you should engage in that, especially with plenty of teenagers at this point?
Yeah, that's a really great question, and I think what let me see, since COVID quarantine, I think a lot of us were unsettled and dysregulated. Everything that, like patterns of behavior that we'd had for so long and become reliant on, were kind of like just pulled out from underneath our feet. And we came face to face with unknowns, a lot of unknowns, which naturally comes with anxiety, right? And so as parents, I think we live in a bubble of unknowns a lot of the time, especially as they go through different lifespan developmental changes. So the really, really short answer is, yes, you can allocate certain times of the day, the week, whatever, to sit in that space with your child. B, what I found is that we don't live in a vacuum, neither do teenagers, and so allocating time, hey, let's sit down and for the next like 30 minutes, 15 minutes, let's just talk in a judgment-free zone. I've not seen that regimen working as well as I've seen parents spending time just with themselves, not with their kids, before they speak with their kids, learning how to listen to their own thoughts. Again, kind of circling back to the mindfulness piece. So spending some time thinking about, well, if I'm finding it difficult to be non-judgmental with my child, then let me sit with some of my own thoughts and notice when I'm being judgmental with those thoughts, right? So sometimes that's a way of practicing speaking in a manner with your children or with your family members, whomever, in a judgment-free space. Is spending some time just noticing how you yourself or how you yourself are being judgmental with your own thoughts. Because typically what happens is there's a parallel processing dynamic. Like with social anxiety, for instance, if I am socially anxious and I spend a lot of time judging other people in my head in social engagements, then chances are when I'm in a social engagement as well, I'm going to think that everybody else is doing the same thing I'm doing to them in my own head, right? And so if I spend some time practicing and taking notice of when I'm being judgmental in my own life about my own activity, and I learn how to curb that and reframe that, sometimes it'll make it easier during the times where we're speaking to our teenagers or our kids in a non-judgmental space. Yes?
Do you have a rule of thumb about how much time per day or per week?
No, what
Try
I...
to have those conversations.
Yeah, in my personal experience, and you can speak to this too, it's really difficult to, because we don't exist in a vacuum, it's hard to allocate certain times. But you could, for instance, preface a conversation with, hey, I want to have this discussion with you, but I want to do it in a space that's non-judgmental. If you notice me being judgmental, let's call it out, let's talk about it. But part of my role as your parent or your guardian is that I also need to judge what's right and wrong for you, because you're not at the stage in your development where you can determine that fully for yourself. So I'm going to go back to being judgmental about certain things because that's my job as a parent, part of it. But I want to open up this space right now just for the next 10, 15 minutes. But I can't say, hey, 5 minutes is a good amount, or 10 minutes is a good amount, or an hour a week, or because there's really no, it's such an abstraction that it's hard to measure. So we don't have any sort, I can't recommend you a certain amount of time. But I will say that if you're only giving about an hour a week, and you give an hour and 1 minute, that 1 minute is going to be life-changing for your child. Yeah.
Yes, you mentioned multiple times that the chemical imbalance. Are there tests that you can perform to find out if it's listening harmful and based in clinical behavior?
Yeah, so no, there's no blood test that I can actively see how much serotonin is in your body, right? The reason why is because you can have serotonin in your bloodstream, but is it getting to the proper neurotransmitter and making the connection it needs to, right? That's where it becomes a little bit more complicated. So no, there is no blood test for it. There are things like qualitative EEGs and SPECT scans that you can see that, okay, we can see where blood flow is going to certain parts of the brain, but no, to say the problem in psychiatry is that a lot of it is still theoretical. It's kind of the unknown, right? So yes, you can have a lot of serotonin, but it's not making its way into the neurotransmitter the way it needs to. So that's why you have depression or anxiety, because of that connection. And not all mental illness is directly connected to the neurotransmitter specifically either way. So it's a case-by-case basis. But no, there's no blood test to say, oh, you're deficient in dopamine, you're deficient in norepinephrine. No. I wish there was, but no, not yet. Going back to your question really quick, there was something I read that really resonated with me a long time ago, was that this is just an option. The special times for kids and adolescents is in the morning, right after school, and before bed. So if you can try and heal your therapeutic relationship with your child in those 3 parts, right? Because look at your mornings. I mean, I look at my mornings, I'm not perfect, I'm screaming, you know, I'm trying to get them ready. Sometimes I lose my cool, right? I'm not always so therapeutic and loving when I've told you 5 times to put your clothes on, right? So it's like, if you say, hey, I'm gonna really try and make like these mornings a little bit more zen. Like if you could help me out, that would be like really appreciated. Maybe we can do like a routine or like a positive message and come at it from a place like I'm trying to make my mornings more peaceful, right? So you put kind of the blame on yourself so they don't feel like they're being attacked. So I find I really try and slow down my mornings, after school, and right before bed. They found that those are, you know, some of the more impactful times.
So I saw a question here, but I want to answer just a couple more questions before circling back, if that's okay.
Yeah, my question is, in the example you provided at the beginning with, you know, evolution and the caveman, how much of anxiety and depression is external events coming at you, like trauma, and how much is internal events and, you know, your chemistry?
Both.
Yeah.
Both. Yeah. There's like the concept of resiliency, right? So that's another thing that I you know have educate a lot on, is that someone can drown in 10 feet of water and someone can drown in 2 inches of water, but they're both still drowning, right? So there's something to be said about resiliency, and that can be genetic, that can be just, you know, your support system, right? So again, it's really case by case. Some people can have everything going great for them and they're still anxious because of a neurochemical component. Someone can have the neurochemistry 100% accurate, no family history of anxiety, but then they're encountered with trauma and then they develop anxiety or depression. So again, it is case by case.
It's also, I mentioned the cognitive triangle earlier, so, you know, things could be, a person could be resilient. Let's say they're in a war zone, right? Their external environment is extremely stressful and traumatic, but they might be regulating pretty well. They might be highly resilient. And that doesn't mean that they're delusional. It means that their belief about themselves, other people in the world, and the world around them has protective factors. So just because they're living in this hypothetical war zone, but they're functioning and their mood is regulated, they've somehow, and I would want to explore and find out, not just as a therapist, but as an individual, like how is this person so resilient? I would want to explore what are their protective factors, how have they maintained their belief about the world around them in the midst of such chaos, right? Like how have they still had a positive outlook on other people when they've seen such atrocities? How can they believe positivity about themselves or their higher power without being influenced by their immediate environment? So it can work both ways. So, you know, in a perfect world, a person can still feel depressed and anxious. In a not so perfect world, a person can still be regulated in mood and functionality. Okay, I'm going to come back to you now. One more.
Just for the sake of time, and then you're both going to stay behind.
Okay.
Okay.
So I'm going to pop over here because I saw somebody else's hand up earlier, and then maybe after we're done. Yeah.
Mine wasn't so much a question. It was more in response to her question. Is
Okay.
that just personally, I find, because I have a handful of kids, that the best check-in for me is just the car.
The car?
Because they're trapped.
Yeah.
And so, 3 days a week after soccer.
So she was sharing in response to a question that.
I mean, for me, it's like 3 days a week after soccer. Each kid gets picked up by themselves with no other kid in the car. They sit in the front seat, and they're just trapped.
They're forced out of circumstances to ride in the car. So sometimes the car is the best zone for her because.
It's my favorite time. I mean, I don't want to be driving.
I don't want to be driving back and forth to 3 different soccer practices, but it is the only time during the week that I feel like they're vomit in the mouth. They're sitting next to me. I'm not looking at them because I'm looking at the road, so they don't see me staring at them. They don't see me like all over them. I'm like, and it just keeps coming and coming and coming, and I find out about all the friends and all their, and I think that they don't realize how much I get out of it, you know, because at home they just want to go to their rooms. They don't want to like talk to me. Then they come 2 girls in a way, and then they come in their room and they're like, what are you doing? Why are you here? So anytime I like act like I'm gonna come talk to them, they're like, what's your problem? But in the car, I don't know what it is. They like don't pick up on it. They're like completely, you know what I mean, like sensitized to me. Like, oh really? Oh, I can't believe that happened. So tell me everything. Anyway, that's all that works for me is the car because their front seat, they're right next to me. They're trapped. Like, you know, I'm not looking at them. I don't know why, but for mine, that seems to help that I'm not staring at them. Anyway, that wasn't my question. I didn't know questions. You can answer.
Thank you. Do we stop time for a question?
Yeah, you should.
I'm a lucky parent today. I get the last question. Okay, so I think it's fair to say that everybody here is a very engaged parent and we're paying attention to any little signs that may arise. So then on the other side of being like over parenting and being like a hog and then thinking like, oh my God, you know, she's doing like this in the fingers and there's a new thing, are we anxious, you know? I guess my question would be, is preventive therapy something good or is that like you need therapy to chill probably? You know, like I'm just like when you take a proactive that you're saying, okay, I'm noticing little changes, right? So are certain transitions, right? You're starting middle school, you're making new friends. Like, would it be like a nice checkup to sort of take your child there, or is it like no, just relax and you know, let them be resilient and figure it out and you know just grow?
Yeah, so you're thinking not just like a parent, but like a therapist, right? So even when we're regulated and mood stable, we still go in for check-ins, right? Therapists need therapists. So I would say yes, it's of course going to be helpful for anybody regardless of their stage of life or how high or low their stress or depressive levels are. It's helpful, right? Because we can all use more perspective giving. The trick is, and what I would recommend everybody in this room to do, regardless of whether they themselves are seeing a therapist or a doctor or know a family member, is make sure that you're regularly checking in that there are objectives at hand in therapy that are being covered, so things are not so laissez-faire that everything under the sun is being covered, because sometimes that's not helpful. It's not hurtful, but it's a bit of a waste of time. So if you're going to be checking in with somebody or touching base with somebody, I think it's incredibly helpful. If you want to get the most out of those encounters, make sure that there's something that the therapist or provider or doctor is covering with you or your family member, or whoever it might be.
When it comes to prevention, so from a preventative standpoint, I think that if they are open to it, like that would be one that I wouldn't like force on them. They're like, I'm fine, I would leave it be, right? If they're open to like, hey, you wanna like go talk to someone that like isn't me, you know, that you can just be kind of your person to help you out, organize your life, right? Because there's a lot of things therapists can do, right? It's not just like, why are you sad? You know, tell me about your history. Tell me about your parents. No, it's, you know, oh, how are you coping with this? How are you organizing yourself? How is your relationship going with peers and things like that? So if they're open to it for prevention, then yes, but I don't think if they really don't feel like they need a prevention thing, I don't know if I would push it, just because then they'll be resistant in the future.
When you might need it.
Mm-hmm. So that would be like, if they're open to it, then I think it would be, you know, a good idea. And it would be like, what, every 3 weeks, something like that. Something very little to like work on just stressor.
Yeah, I have clients that I meet with once a month, once every 3 or 4 months, once every 6 months. So when they're in that maintenance stage, sometimes they can use like just checking in. But I know our time is up. Denise, Lynn, Annie, thank you so much.